pediatric hurt, as well as a trauma with abdominal tenderness for an adult. I'll give you the
okay, you said a critical pediatric trauma as well?
No, not arrest, just critical hurt from in a traffic accident.
Okay, but we're not a pediatric trauma, so is this patient a part of the trauma? I'm just worried about the pediatric patient.
Yeah, no, the pediatric, he's not injured from the traffic. He's just burned from the traffic. Do you understand what I'm saying?
So he's burned, and where is he burned at?
What was that?
Where is he burned at?
He's burned on his entire head, second-degree burns. Both arms, he has third-degree burns.
Let me talk to one of the doctors, because I think this patient should go to a pediatric. Just because, let me just talk to one of the doctors. Give me 1 second.
Got it. Yeah, it's just a burn.
He's checking. Yeah, right. Yeah, that's what I'm talking about. I'm just saying.
He's not burned on his face, right?
What was that?
Is he burned on his face at all?
He's burned on his face, yes. He's burned on his entire head. But there's no, he only has a burn. He has no other trauma injuries. So we're not running it as a trauma. It's just, we're going to the EDAP because because it's a burn patient, that's all.
Okay. How old is he?
He is 9 years old. He is orange 26 on the broad lobe. Right now he's 8 times 3, he has 15. We have an instant cup refill. He's batting at 99% on 15 liters. So his burn injuries are second-degree burns to his entire head. Looks like there is no soot in his mouth, no ash or anything like that. We have a third-degree burn to the arms and hands. It's more severe on the left side. We also have second-degree burns to his knee. His chest is...
How's his airway, the doctor wants to know?
What was that?
How's his airway, the doctor wants to know?
His airway is patent and clear. His lung sounds are clear bilaterally. I already got it. Okay. So he has no history, knowledge of meds. We're going to be there in approximately...
How far out are we?
About 7 minutes to your facility. We're working on establishing it.
Just give me the rest of the vitals.
What was that? We don't have a blood pressure right now. His cup refill just less than 2 seconds. He's got burns across both extremities, so we don't want to put a blood pressure cuff on it right now.
Okay, but what about his legs?
Do you want to, okay, do you want blood pressure cuff?
If you can, get the blood pressure cuff. Do we have a pulse at all? And what's his respiratory rate?
Yeah, I got you. So his pulse is 112, strong and regular. We don't have him on the cardiac monitor yet.
Okay, and respiratory rate's about, what, 24, 20?
The respiratory rate is 28, and it's good, normal tidal volume.
Okay, and you guys have clean, sterile gauze on those burns and everything?
What was that? Yes, we're working on clean syrup. Yeah.
Okay, and who's the other patient?
Okay, the second patient? Give me one more.
Right. You need to get out here. There's 4x4. There's like, sorry, I just want the
yeah. So we have...
Yeah, okay.
33-year-old female involved in the actual traffic accident, complaining of left abdominal pain. It is diffuse. There's no bruising, just pain. She is ANO times 3, CPS of 15. Skin signs normal, warm, and dry. Pupils are pearl. Intact chest wall. Stable pelvis. There's no distension in the abdomen. She has no other complaints of pain. She was ambulatory on scene. She has no history, no allergies, no meds. We haven't, her blood pressure is 134/80, pulse of 120, respiration rate of 20, lung sounds clear bilaterally, SpO2 of 98% on room air. We're in your ambulance bay right now.
Okay, wait, I just have one question. How did he get burned? What was on fire?
The van they were in was on fire.
Okay, and these are the only 2 patients that we're getting, or should we prepare for others?
As far as I know, these are the only 2 patients. I'll get in contact with the rest of our base here.
Okay, I'll just see you guys in a couple seconds.
All right, thank you.
Yeah, well, they were patients. They get documentation.